Can you tell us a little bit about how intensive hemodialysis fits into your center and all of the patients you care for, which is a pretty geographically diverse area, right?
Yeah, we have a very large, as Canada is, a very large geographic mass. With most of us huddled along the U.S. border for warmth, I joke. My province, we have 800,000 people in one city, and our province has 1.4 million people in total, and they go all the way up to the Arctic Circle. If I look at the epidemiology, certainly in Manitoba, we're looking at probably a doubling of our dialysis population in the next 10 years. We do have a network of satellite hemodialysis units across our geography, but I consider that almost a failure. We know that there's clear differences or cost-saving advantages to doing home therapies in general. And yet in the US and in Canada to an extent as well, there's been a tremendous investment in capital infrastructure and capital facilities. So there's a vested interest in maintaining that status quo. I think in terms of resource allocation, we're far better off performing screening and surveillance and public health activities. We're far better off supporting patients on a home therapy. And I think that that's where we should be investing time and effort and technology, and not the sort of, I would say, older way of just using conventional facilities to do inadequate dialysis in many cases. But again, in a very geographically diverse province, with often places in rural communities having poor water quality, houses that rely on tank water or septic tanks, it's just not feasible to have a RO system running which churns through 200 or 300 gallons plus of water a treatment. Having this simpler technology doesn't require as much infrastructure within the home or use of water or septic fields or septic tanks. Low flow dialysate systems have been something that offers this therapy to patients that just wouldn't be able to do it before.
So do you have any interesting stories about, say, established patients, 3-4 years on hemodialysis, typically on a conventional schedule, and then they have converted over to a more frequent schedule?
So many fantastic stories in this area. I had one particular patient who'd been on dialysis, and he had multiple transplants, and he's been on dialysis for 25, 30 years, and he's been on PD, he's had 2 transplants, been on conventional in-center systems, and he really wanted to try this. And he was my first patient that we trained with again, nurses that had not been experienced in home modalities, new technology staff and so on. And he really bought in and wanted to do it, and went home on nocturnal, and was just, color came back in his face. He was more energetic. He was just had a new sort of zest for life, but with equipment that still relatively requires a lot of time to invest into, to set it up and take it down and do 5 or 6 nights a week in nocturnal dialysis. He's a person that really likes to go to his cottage. So in Manitoba, we're big cottage people. I know in Minnesota you are as well, and summer everyone's gone into the city, and he had this cottage and about 2 hours out of Winnipeg, and would go there for a couple of days and then drive back to Winnipeg for 2 hours, dialyze, and then drive back to his cottage. So very sort of interrupted. He's a retired guy. He's got to have a long history on dialysis. So we convinced him to try when the more portable system came out with lower flow dialysate, to maybe give it a try for the summer. He really wanted to try to go to the lake for the whole summer. He sent me a picture with him dialyzing at his cottage with the lake in the background on the dock, with his machine holding his granddaughter, and that's something he meant the whole world for him to be at the lake for the whole summer, and give him back the thing that he loved the most in life was doing that with his family, and not have to worry about his lifeline of driving back to the city to do dialysis. So stories like that are just so incredible.